Hey guys, welcome to Fun Learning. Today we are going to start the ankle biomechanics. With no further delay, let's get started. Introduction. The ankle or foot complex composed of 28 bones which forms 25 joints. Those joints are nothing but proximal and distal tibiofibular joint, ankle joint, subtalar joint, transverse tarsal joint, 5 tarso-metatarsal joint, 5 metatarso-pharyngeal joint and 9 interpharyngeal joint. So, the ankle or foot complex composed of 28 bones which forms 25 component joint. For better understanding, the ankle or foot complex is further divided into 3 segments mainly, which are nothing but real foot, mid foot and forefoot. Real foot matlab the posterior segment which composed of talus and calcaneum. Midfoot is the middle segment which composed of navicular bone, cuboid bone and 3 cuneiform bone. Forefoot is nothing but the anterior segment which composed of metatarsals and pharynges. Now let us discuss about the ankle joint in detail. The ankle joint is also known as talocrural joint. In order to remember the type and subtype of ankle joint, try to remember the mnemonic as. In that H stands for hinge joint, A stands for ankle joint and S stands for synovial. Now let us discuss about the articular surface of ankle joint in detail. First let us discuss about the proximal articular surfaces. Under this you have to remember 5 important points. Those are nothing but first point is the proximal articular surface of ankle joint composed of concave surface of distal tibia, tibial malleoli and fibular malleoli. So this is the first point. The structure of the distal tibia and the 2 malleoli resemble mortise. The third point is the mortise can be either fixed or adjustable in nature. Here the mortise of the ankle is adjustable in nature which relies on the proximal and distal tibiofibular joint. The fifth point and final point is the proximal and distal tibiofibular joint anatomically distinct but contribute to ankle range of motion. So these are the 5 important points you have to remember under the subtopic proximal articular surfaces. As I said previously, the ankle joint relies on proximal and distal tibiofibular joint, right? So now let us discuss some points under proximal and distal tibiofibular joint. First, let us discuss about the proximal tibiofibular joint. So, the proximal tibiofibular joint is a plain synovial joint and it is formed by the articulation of the head of fibula with the posterolateral aspect of the tibia. Generally, a convex tibial facet and concave fibular facet is the most common articulation pattern. That is, the facet at tibia and fibula varies. Okay, so varies from one individual to another individual. So, for some individual, there may be concave facet present in the tibia and convex facet present in the fibula. But mostly, there will be a convex facet that is present in the tibia and a concave facet which is present in the fibula. So, these 2 points you have to remember under the proximal tibiofibular joint. Now, let us discuss about the distal tibiofibular joint. So, the distal tibiofibular joint is a syndesmosis or fibrous union between the concave facet of the tibia and the convex facet of the fibula. The anterior and posterior tibiofibular ligament and interosseous membrane provide support to the distal tibiofibular joint. Although the distal tibiofibular joint is an extremely strong articulation, injury can occur when the talus is forcibly dorsiflexed and abducted within the ankle mortise. These injury can cause tibia and fibula to separate. If the force were to continue, fracture of the fibula proximal to distal tibiofibular ligament could result. So, what they are trying to say under the distal tibiofibular joint is nothing but, first point is it is a syndesmosis or fibrous union, and second point is nothing but there is anterior and posterior tibiofibular ligament and interosseous membrane that provide support to this joint. And third is very important point, which is nothing but when the talus is forcefully dorsiflexed and abducted. Okay, there is chance of distal tibiofibular joint to get injured. And initially what happens, the tibia and the fibula separate at the distal tibiofibular joint. But if this force continues, if the talus is continuously forcefully dorsiflexed and abducted, even after the separation of tibia and fibula, what happens? There is more chance of getting fracture at the fibula proximal to distal tibiofibular ligaments. Okay, now let us discuss about the distal articular surfaces. So hopefully you remember the proximal articular surfaces, which is nothing but the concave surface of distal tibia, the tibia and the fibular malleoli. Now the distal articular surface is nothing but the body of the talus. The body of the talus has three articular surfaces, which is nothing but a large lateral surface, a smaller medial surface, and a superior surface which is known as trochlear surface. Now let us discuss about the ligament of the ankle joint in detail. Now let us discuss about the capsule and ligament of ankle joint in detail. The capsule of the ankle joint is fairly thin, especially weak anteriorly and posteriorly. Okay, va? Now let us discuss about the ligament. So there are many ligaments that is present at the ankle joint, but among those ligaments there are two important ligaments in the ankle joint are nothing but the medial collateral ligament and the lateral collateral ligament. First, let us discuss about the medial collateral ligament in detail. So this medial collateral ligament is also known as deltoid ligament. First point. And this medial collateral ligament has superficial and deep fibers. Second point. And this medial collateral ligament arises from the, as the name suggests, it is a ligament which is present medially. This is arise from the tibia. So to be specific, this is arise from the tibia malleoli and get inserted in a continuous line anterior to posterior on navicular, talus and calcaneum. So this ligament get arise from the tibial malleoli and get inserted on the navicular, talus and calcaneum. And this ligament is an extremely strong ligament. Okay, va? So excessive eversion or pronation of ankle and talus can injure the deltoid ligament. But as I said previously, this ligament is the strongest ligament. So if there is excessive eversion and pronation, first there will be fracture and displacement of tibial malleoli. Later this ligament tear. Okay, so in the ligament ரொம்ப strong ligament அப்படின்றதுனால ஒருவேளை eversion and pronation ரொம்ப excessive இருந்துச்சுன்னா first tibial malleoli fracture ஆகி displace ஆகும், later தான் deltoid ligament tear ஆகும் அப்படின்னு சொல்றாங்க. So அந்த அளவுக்கு the most strongest ligament is the medial collateral ligament. Now let us discuss about the lateral collateral ligament. So this lateral collateral ligament composed of three distinct bands, which are nothing but the anterior talofibular ligament, posterior talofibular ligament, calcaneofibular ligament. So these three ligaments together we call it as lateral collateral ligament. And this lateral collateral ligament help control inversion or supination of ankle and talus. Okay, va? So medial collateral ligament control eversion or pronation of ankle and talus, whereas the lateral collateral ligament control inversion or supination of ankle and talus. Now let us discuss about the movement that occur at the ankle joint. Before going for it, you have to know the axis at which this movement occur, right? So what is the movement that occur at ankle joint? Which are nothing but the dorsiflexion and plantar flexion. Before going to discuss about this two movement, you have to know about the axis. So this axis, which is known as Talocrural axis, passes through the fibular malleoli, body of talus, through or just below the tibial malleoli. So the talocrural axis passes through the fibular malleoli, body of talus, through or just below the tibial malleoli. So this is the first point. And second point is that this fibular malleoli as well as the fibular facet which is present at the body of talus is located more distally and posteriorly when compared to the tibial malleoli and the tibial facet on talus. And this is because there is some normal torsion that exists in the distal tibia in relation to the proximal tibia. Okay, so very simple. What they are trying to say under the second point is nothing but the fibular malleoli and the fibular facet is located more distally when compared to a tibial malleoli and the tibial facet on talus, because of the normal torsion that occur at the distal tibia. Okay, because of the distally located fibular malleoli, what happens? This axis, that is the talocrural axis, when we see from the posterior side, that is from the posterior view, the talocrural axis is 14 degree away from transverse plane. When we see it superiorly, from the superior view, this talocrural axis is 23 degree away from the frontal plane. These are the three important points you have to remember. And the fourth will discuss about the motion, which is nothing but the dorsiflexion and plantar flexion. Okay. So during dorsiflexion, what happens? The body of the talus moves posteriorly in the mortise, whereas during plantar flexion, the body of the talus moves anteriorly in the mortise. Okay, as I said previously, this talocrural axis is somewhat an oblique axis. It is not in a particular plane, right? So the dorsiflexion is not a pure dorsiflexion occur at the ankle. So always the dorsiflexion is accompanied by the abduction and eversion, whereas the plantar flexion is accompanied by the adduction and inversion. Okay, but these rotation, that is the abduction, adduction or inversion, eversion, so these are relatively small in comparison with the dorsiflexion and plantar flexion. So the range of motion of dorsiflexion is 20 degree, whereas the range of motion of plantar flexion is 50 degree. And dorsiflexion is considered to be the closed packed position for ankle joint, whereas the plantar flexion is considered to be the loose packed position of ankle joint. Okay, the asymmetry in size and orientation of the facet in body of talus, as lateral facet is larger, the distal tibia which is moving on it must undergo a greater displacement than the tibial malleoli, as they both move together during dorsiflexion. The greater arc of motion for fibular malleoli compared with the tibial malleoli result in superior or inferior motion and medial or lateral rotation of the fibula that require mobility of the fibula at both proximal and distal tibiofibular joint. With this, I am completing today's video. Thanks for watching. If you like this video, please subscribe to my channel.